Okay, and good morning, and thank you for joining us here today on Blackfoot territory. And I recognize the Métis people who share a deep connection to this land. I am joined here this morning in Lethbridge by NDP leader Rachel Notley and Vicki Todd, who is a birth doula here in Lethbridge. The UCP has created chaos in our healthcare system, and that's causing real harm to families across the province. Attacks on family doctors by the UCP government during the pandemic drove many physicians out of the province, to the point where now here in Lethbridge, 40,000 people here in this city and in this region do not have access to a family doctor. That means that families have nowhere to go but the emergency room. That adds weight to wait times for our EMS frontline services, for our ambulances, and of course, in our hospitals. But there is another aspect of the UCP's healthcare chaos that we need to talk about. There is now a terrible and worsening shortage of obstetric and birthing care here in Lethbridge. Lethbridge right now has one OBGYN in a city of 100,000 people. This affects all communities in southern Alberta that rely on care here at our hospital. Restricted access to obstetric services and birthing care is being felt across the province. We have seen communities of Slave Lake, Edston, Whitecourt, Barhead, Lac La Biche, St. Paul, Three Hills, Fort Saskatchewan, Bonnyville, Westlock, Rocky Mountain House, Rimbey, and Sundre all have had closures of some form or another in obstetric services this year. This is not the fault of healthcare workers, physicians, or others who work in our healthcare system. It is the fault of a UCP government that has combatively attacked healthcare and pushed the system to the brink. This must be urgently addressed. Families in Lethbridge should have the certainty that they will have all the care they need to have their baby right here in southern Alberta. I want to take a moment to acknowledge the hard work that AHS is doing to try and manage this situation. But we should not be left in this situation to start with. We shouldn't be left with so few local healthcare workers right here in Lethbridge. So I want to welcome Vicki Todd, who assists women here in Lethbridge with their birthing process and women and families, to share more about the situation here for expectant families.
I'll go in the box. Good afternoon. My name is Vicki Todd. I'm a certified birth doula who operates here in the city of Lethbridge. The current state of obstetric and gynecology care in our city is truly worrisome. Here in Lethbridge and across Alberta, the number one reason for hospital admission is childbirth. The number one performed surgery is cesarean section. Last year, Lethbridge and area families gave birth to more than 1,000 babies. And as of this month, there is only one OBGYN for the entire population. Around 20% of these pregnancies will result in a high risk that requires an OBGYN. Approximately 10% of families in Canada require fertility support. That requires an OBGYN. Up to 30% in Alberta of births in Alberta happen by cesarean section. That requires an OBGYN. And around 30% of these patients will go on in their lifetime to require a hysterectomy. That requires an OBGYN. Since June of this year, Lethbridge has seen a rapid and steady decline in obstetric and gynecology services. We are left with one single OBGYN to serve not only Lethbridge, but north to Claresholm, south to the border, east to Bow Island, and west to the Crow's Nest Pass. As a birth doula, I provide non-medical support to pregnant families, and I see and hear firsthand the effects this has. Having continuity of care with a care provider offers patients an opportunity to establish a relationship of trust. Patients need to feel comfortable and confident in the care and information their care provider gives them to make informed decisions in birth. Today, Lethbridge families requiring obstetric care as part of their pregnancy and birth may not be able to access their provider in a timely fashion. They may have to drive to other high-risk capable communities such as Calgary in order to see an OBGYN. they may have their post-surgical appointments overseen by a local GP. That is, even if they have a local GP. That's another shortage Lethbridge is experiencing. Tens of thousands of families do not have family medical practitioner to oversee their pregnancy confirmation, early maternity care, or postpartum follow-up. In the world of birth, we talk about the cascade of interventions, the phenomenon where one medical intervention seems to lead to another and another and another, often culminating in a negative outcome. Lethbridge's obstetrics care situation is very much the same. The lack of available care places, undue emotional stress, and logistical asks on pregnant families. In turn, this stress can continue to maternity complications such as high blood pressure, preterm labor, or mental health concerns. These complications can lead to higher risk births, including inductions, premature birth, birth trauma, longer than normal hospital stays, or increased incidence of postpartum depression and anxiety. For a community of 100,000 and surrounding area, one OBGYN is simply unsustainable, uncertain, and unacceptable. Healthcare, including the care of our most vulnerable, brand new Albertans, is nonpartisan, and all families deserve access to obstetrics care within their community.
Well, thank you so much, Vicki, for sharing about your understanding and your awareness of the urgent problem of restricted birthing and obstetric care here in Lethbridge. My heart goes out to all those expectant parents who are living with the stress of not knowing if the care that they need in order to deliver their child safely will be available for them in their community when they need it. Fact is, that's just not right. As Shannon said, this is a city of 100,000 citizens with a hospital. And delivering babies is one of the most basic functions of a hospital. And we can get just how much damage the UCP has caused when those basic functions begin to fail. So I am committed to addressing the crisis in healthcare so people can get the healthcare that they need in their community. The people in Lethbridge and all across Alberta deserve so much better. I fully believe that the healthcare workers here in Lethbridge are doing everything they can, just as Shannon said. They are working in an unbelievably stressful situation, and they are trying very hard to continue to provide the maternal health care that the people of this community need. But the fact is, it just can't go on like this. These workers and all Albertans deserve better than a government that's fixated on firing people and has literally no idea about how to hire them. On the weekend, Danielle Smith alleged, without any proof at all, the most outrageous thing. She suggested that the staff shortage in Alberta's healthcare system was entirely manufactured. To be clear, the shortage that Vicki just described with respect to obstetric care and family medicine is real, and also it is a very complicated problem that will require a very thoughtful and strategic solution. But I will tell you this, it is never going to be solved if Alberta's political leadership is running around making up things, literally making up lies about the system and pretending the problem doesn't exist. That is irresponsible nonsense, and it's a terrible insult to all the frontline healthcare professionals who have endured the past 3 years, not to mention the hundreds of thousands of Albertans who they care for. An Alberta NDP government will end the chaos in our hospitals and bring real resources to the front line. We will work collaboratively with healthcare workers. We will stabilize our hospitals, and we will get resources back to those front lines, and we will launch the largest healthcare recruitment campaign that Alberta has ever seen. An Alberta NDP government is committed to addressing the crisis in healthcare so that families in Lethbridge and across Alberta can safely have their children in their own communities. So thank you, and we are all here to answer any questions that you might have.
Hi, I have a couple questions for Vicki. David Opinko from Lethbridge News Now. So I'm just wondering how long has the OB shortage been, I guess, to this extent? And because I'm aware at least one of the OBs is on a mat leave right now. So I guess without significant actions being taken, is this a problem that'll resolve itself, or will it kind of need that kind of significant action?
In June, we had 7 obstetricians serving this community. Now we have 1. We have 2 currently out on maternity leave, and hopefully they'll return, but we would never wish to rush those folks back into practice, just like we would never ask any new parent to rush back into their work.
And just to follow up as well, we've heard from AHS that there's been a couple of locums who've been coming to kind of help as they can. Has that been making much of a difference, or is there still a pretty big gap in services?
Locum care is in hospital. So anytime somebody gives birth in the hospital, they will be taken care of. It's prenatal care that is lacking, especially for high-risk patients and actually reproductive care as a whole.
Thank you.
You bet.
Yeah, this question is for Vicky as well. My name's Sean Marks, CTV News. I'm just curious, how many OBs do we need here in the city to properly run and make sure that our residents are taken care of?
The 7 that we had seemed to do the trick. However, OBGYNs are meant for high-risk population care, so the low-risk population needs some support as well.
And then to follow up, what kind of effect is this having on our healthcare system, especially when we're seeing places like Milk River not running on certain days, and we're accepting people from all over southern Alberta to, take care of them?
It's provided a lot of uncertainty and undue stress on expecting families in a time where they should not be stressed or uncertain at all. Thanks.
Hi, this is Alejandra from Lethbridge Herald, and if I can ask Rachel a question, what would be something that you would be able to do if you get elected to be able to recruit more physicians to come to Alberta? And are you looking into maybe perhaps expand that into foreign medical physicians?
Right. So a couple of answers to that. First of all, we need our leadership that we currently have to stop engaging in strange conspiracy theorists and strange conspiracy theories, and to understand that down here on planet Earth, there is a crisis in our healthcare that we need to focus on. So if we get to the point where we understand what the problem is, there are a number of things that we have to do. We have to stop talking about creating more chaos in our healthcare system and start talking about growing stability and giving stability to folks in the system. We need to get more resources to the front lines. We are actually suffering from significant cuts that the UCP have made to our healthcare over time. We need to work collaboratively with our healthcare providers on innovative ways to ensure that there's greater delivery. Absolutely, we need to be looking at foreign credentialing and better recruitment and better full practice to scope of those folks who are foreign trained and foreign certified with respect to their medical expertise. Ultimately, we need to be looking at ways that we would develop in consultation with those frontline healthcare providers to more efficiently deliver the kind of healthcare to Alberta families that they need.
Thank you so much. And if I can have a follow-up question to Vicky, maybe? Hi. So you mentioned that obviously for emergency cesareans or cesareans in general, people need an OBGYN, obviously. Now that we only have one, what kind of procedures have been following? And is there any other type of physicians that are able to take on that task, or what are the expected mothers expected to do, I guess?
For low-risk care. For low-risk care, basically they're being sent back to their GP if they have one. We do have a small group of general practitioners who does take care of low-risk pregnancy. And we also have a few local midwives who do low-risk care as well. But midwives only care for 5% of the population in Alberta, 2% out of hospital.
Sorry, maybe I didn't explain myself, but at the hospital,
Oh.
at the moment of birth, because we only have one OBGYN.
Yes.
Are there other type of physicians that can step in to help with, because I'm guessing more than one baby is born at the same time.
You bet.
What are they doing at the hospital level?
Yeah, so they have something called a locum physician, and that's a physician that travels from other communities to kind of bridge the gaps and cover when there is no doctor available. Those are always on site, and there's always one OBGYN on site for that emergency purpose. And hopefully people also have other care providers with them as well. Yeah.
Thank you.
You bet.
Hi, my name is Saloni. I'm from CBC News. My question is for Rachel and Shannon. So this seems to be a healthcare crisis, as you've addressed, and many women need that care on an everyday basis. Like they're struggling to get OBGs, they're struggling to get referrals and whatnot, and even here, if they have to go to Calgary or not, what can you do now to address that urgent need? Like, what can the NDP really do?
Well, right now, you mean if we were in government? Or just,
Yeah,
just
in general,
because
yeah.
right now, as the official opposition, we can raise the issue and we can put the pressure on the UCP government to stop engaging in conspiracy theories, to start properly funding our healthcare system, and to roll up their sleeves and work collaboratively with the healthcare leaders within the system to solve the problem, as opposed to demonizing the vast majority of them and promising to blow up the healthcare system. Now is absolutely not the time to do any of that. Certainly, if we were in government right now, there's a number of things that we would do. We would embark upon the most aggressive physician recruitment program you will have ever seen in this province. We would ensure that there were more resources going to the front lines. We would immediately expand the number of spaces across the province to train more healthcare professionals. We would look at ways in which we could expand the scope of practice for those who are within the system. And we would find ways to recruit folks who have retired back into the system and perhaps incent them to come back for a period of time while we're growing that healthcare workforce. So there are a broad range of ideas, and we will be talking more about some of the specifics in the weeks and months to come. We very much hope to have a pretty detailed plan to lay out for Albertans that they can have some trust and faith in before they go to the polls.
To follow up to that, I know you mentioned like that you would expand it in terms of the province, but when it comes to Lethbridge, it seems like this shortage and the crisis specifically is being felt in Lethbridge. Calgary, Edmonton seem very better off, and from a doctor's perspective, I would think like the question is, why would a doctor not want to practice something in a city like Calgary and come to Lethbridge? How do you make them stay?
In Lethbridge?
Lethbridge.
Well, I think probably what you're going to have to do is sit down with the group of folks who provide obstetric care and look at what can be done even on a short-term emergent basis to expand their presence here in Lethbridge. And then you also have to look at again, maternal care and obstetric care overall. Vicky's been talking about low-risk care and the different types of care that expectant mothers can get before they get to the point of needing obstetric care. And so that's another thing to be addressed along with the issue of the shortage of family physicians. But certainly, I think it would be important to be sitting down with obstetric specialists and looking at what we can do to incent greater number of them to be here as we look at the longer-term systemic issues to smooth some of this stuff out.
How optimistic are you about the pressure? Like, how soon do you think the UCP is really going to act on this? How soon which? How optimistic are you about the amount of pressure you can put and the outcomes of it, basically?
Well, I mean, I think that, it's hard to say. I mean, I can't speculate on the level of attention being paid to this inside the UCP cabinet. Just on the weekend, we had the specter of Danielle Smith claiming that there was no healthcare professional shortage in Alberta and that this was somehow a manufactured problem by Alberta Health Services. That is ridiculous. And as I said before, she needs to stop engaging in silly conspiracy theories and understand that down here on planet Earth, Albertans are in desperate need of more frontline healthcare, and that the Premier needs to get herself informed and start focusing on that specific issue on an emergent basis.
Thank you very much.
Thank you.
Anybody else? Okay. Thanks, everyone.
Thank you.
Much for watching, and to learn more, check out albertasfuture.ca.